Yesterday, I got a list from Abdullah later about the slides. Okay. This hemodynamic disorders, 2 slides, thrombus and myocardial infarction. These slides I have not told you till now. Maybe you have studied in 3rd year. Okay. But in your list for exam, what Abdullah has sent me, these 2 slides are the thrombus and myocardial infarction. So first I will tell you these 2 things. So what is this? This is a thrombus. Okay. This is a blood vessel. What does a thrombus consist of? You have studied in 3rd year, okay? Thrombosis in chapter of hemodynamic disorders. So whenever there is endothelial cell injury, or if there is abnormal blood flow, or if there is hypercoagulability of blood, 3 things. This is known as Virchow's triad. 3 things, Virchow's triad. If anything is abnormal, if there is either endothelial injury or abnormal blood flow or hypercoagulability of blood, this results in formation of a thrombus. Thrombus is formed inside the blood vessel. This will obstruct the blood flow. Okay. So this picture is about a thrombus inside the blood vessel. It is formed from the constituents of blood. Whatever is present in the blood, the cells, the proteins, so it is formed from these constituents. It is just like a clot which is formed inside and it is abnormal, pathological. Normally whenever there is any injury, there will be bleeding and a clot is formed outside to stop the bleeding. Thrombus is like a clot which is formed inside a blood vessel whenever there is some injury to endothelium. Okay, or as I said, the other 2 things. So this is a slide of a thrombus. So inside the thrombus, if you look at the thrombus, you will find alternate pale and pink lines. Okay, pink lines will be there and pale lines will be there. These lines are because of presence of alternate platelets and alternate RBCs. Okay, wherever you see RBCs, pink line will be there and adjacent platelets, pale line will be there. Even you find some amount of WBCs also in this. So alternating pale and pink lines, they are known as lines of Zahn. L-I-N-E-S, lines of Zahn, Z-A-H-N. Okay. So you might have studied in your theory what are lines of Zahn. Lines of Zahn are seen in a thrombus. Remember this. This is another picture of a thrombus. This is a blood vessel wall. Okay. Inside you can see from here this has started forming and a big thrombus is formed inside the blood vessel. Whenever a thrombus is present, it will cause obstruction to flow of blood. Blood cannot flow. Okay, because there is some obstruction inside the blood vessel. It is not open completely. Some part of it is blocked by this thrombus. So obstruction to blood flow occurs because of this thrombus. So for your lab you should remember thrombus is formed from the constituents of blood. It contains alternate pale pink lines which are known as lines of Zahn. It occurs because of 3 things, either endothelial injury or hypercoagulability of blood or turbulent blood flow or abnormal blood flow. So in this section of blood vessel you see a vascular lumen which is occupied by thrombus, that is the red mass which is adherent to the vessel wall. Lines of Zahn, they are pinkish violet lines. Periphery lines show bluish dots because of presence of WBC and nuclear fragments. Okay, so these lines of Zan are formed inside the thrombus because of RBCs, platelets. Periphery you will see blue dots because of WBCs as well as some nuclear fragments. A network of fibrin is present between the lines of Zan which entangles red and white cells. Okay, so normally also fibrin is present in any clot wherever a clot is formed. So in thrombus also fibrin network is present, fibrin meshwork which holds these WBCs and red blood cells. Next slide is talk about myocardial infarction. Infarct is, what is infarct? Infarct. In your chapter on hemodynamic disorders, you have studied about infarct also. Okay, hyperemia and congestion, edema, hemorrhage, thrombosis, embolism, shock, infarction. Okay, these were the disorders. Infarct is an area of necrosis, localized area of necrosis. Okay, whenever there is reduced blood supply or obstruction to blood flow to a particular organ or tissue, that organ or tissue undergoes cell injury. The cells in that tissue, they die, which is nothing but necrosis. Okay, so a localized area of necrosis because of ischemia is infarct. Now suppose there was a thrombus present in coronary artery. Coronary artery supplies the heart. Okay, there are various branches of coronary arteries. So the artery which was supposed to supply this area, suppose it has a thrombus inside over a atherosclerotic plaque. Okay, so this resulted in decreased blood supply to this part of the heart. Now when no blood supply was there, the cells in this area, they died. Okay, and this showed necrosis. So this localized area of necrosis in this solid organ like heart because of obstruction to blood flow is an infarct. Okay, so you can see this is also infarct, this is also infarct. This is old, this is recent. Okay, so just now there was blood supply obstruction, immediately damage to the cells, and within 24 hours changes started. So you will find a recent infarct here. Okay. This is old, this is recent. Now coming to the microscopy, what do you see inside the cardiac muscle in an infarct? Okay. So here this is a normal myocardium. These are myocardial fibers, myocardial cell. This is the nucleus. All these are cells. They have a normal nucleus. Here in between there is blood supply to them through capillaries. Okay, these are RBCs. Here also you can see this is normal myocardium. Capillary RBCs, nucleus, intercalated disc. Now the area which is affected because of decreased blood supply, that area develops into an infarct. So once a person suffers from heart attack, okay, within 2 to 3 days, because damage has occurred to the myocardium, inflammation starts, which is marginal. This area is live. The cells are live. These are all inflammatory cells which comes into picture because there is injury to the cell. So body responds by inflammation. So the inflammatory cells, they come towards this. This side, whatever tissue is present, the whole thing, this is the area where there was compromise in blood supply. Okay, so all these are dead cells. Now in necrosis you have studied on in morphology. The cells, they appear more eosinophilic, more pinkish in appearance because the cytoplasm takes up more stain. They become more pink in appearance compared to the normal tissues. Okay. Now by 1 to 3 weeks, because after inflammation you have you know about healing and repair also, okay, where the tissues either they regenerate or repair, which is nothing but wound healing. So in the repair process, it can be by scar formation, okay, and if it is due to chronic inflammation, it is known as fibrosis. So here also the repair process starts. During wound healing, there is a tissue formation, normally what we see, which is pink in color, contains more capillaries, it has edema and inflammatory cells. It is known as granulation tissue. So here also, during the repair process, granulation tissue is seen by 1 to 3 weeks. After a myocardial infarction or after a heart attack, 1 to 3 weeks you will find granulation tissue, okay, consisting of many blood vessels. You can see all these are blood vessels. So many blood vessels, many these blue cells are many inflammatory cells. Next, after 3 to 6 weeks, inflammation subsides, granulation tissue subsides, the tissue changes itself into a scar, okay, a pale colored or a white colored scar. This outer is the viable or live myocardium, whereas this was the part which was affected due to decreased blood supply. The patient suffered severe pain because of this, which is known as a heart attack, and this area converted itself into a useless tissue, okay, which is nothing but scar. Now this part cannot take part in the normal function. Like normal myocardium, this part, the function is contraction, okay, pumping of blood to the body. So this part is just, it gives strength, but function is not restored. Structure is restored or protected, but function is not restored by this scar. So these are live cells, live myocardium, this is the scar. After 6 years, there is no inflammation, you can find a old scar, collagen scar in the myocardium. Okay? See, this whole thing is a big scar, useless tissue without any myocardium. Here some viable cells can be seen. So normal area and infarcted area. The infarct area shows loss of details of muscle fibers. The necrotic muscle fibers appear granular and pink with blue nuclear fragments. The zone between normal and infarct tissue shows dilated congested capillaries and infiltration by polymorphonuclear lymphocytes. So that is about thrombus and infarct, myocardial infarction. Okay. So you have these two slides. Then comes what we have discussed already. So I will show you only the pictures. Thyroid gland, there are two slides. One is of Graves' disease of thyroid, second is papillary carcinoma of thyroid. This is normal thyroid gland. These are normal follicles containing colloid. Okay. These are the follicular epithelial cells. These are lymphocytes. This is about Graves' disease. Compared to the normal, here you will find scalloping. The colloid which is secreted here, you can see vacuolated or empty appearance. This is known as colloid scalloping. Okay. Since Graves' disease is the autoimmune disorder, you find lymphocytic infiltration also in this gland, like you see in Hashimoto's thyroiditis. Same way you can see infiltration by lymphocytes. This is another slide of Graves' disease. This is scalloping of colloid. This is the colloid, and these are epithelial cells. In Graves' disease, you see it, since it is a hyperplastic lesion, there is lot of papillary formation, but these papillae don't have fibrovascular cores. Okay, if you see fibrovascular cores, usually it is papillary carcinoma. Okay, but papillary carcinoma, more important to look into the nuclear features compared to the papillary features. So here there is no fibrovascular core. All these are papillary projections. Okay, you have colloid scalloping like this. Okay, lymphocytic infiltrate. Next is papillary carcinoma of thyroid. In papillary carcinoma, you see papillary projections like this, similar to the what you see in Graves' disease. But here there is a fibrovascular core. Okay, it is attached by fibrous tissue. Inside the papillae there will be fibrovascular core. Fibro means fibrous, vascular means blood vessels. So both fibrous tissue and blood vessels or blood supply is through this. More important in papillary carcinoma is the nuclear features. The cells have nuclei. The nuclei has got clearing. Okay, clearing means they appear empty. The appearance of the nucleus is like a orphan girl. Her name was Annie. So this appearance is known as orphan Annie eye nucleus. Orphan Annie eye nucleus. So this type of nuclei is seen in papillary carcinoma. The moment you see such clearing of the chromatin like this, nucleus without any substance, think about papillary carcinoma of thyroid. Intranuclear inclusions. Some nuclei may show presence of a vacuole or clearing, which is known as intranuclear inclusions. Inclusion present inside the nucleus. Okay, like this. This is also seen in papillary carcinoma. Some nuclei may show growing like this. This is coffee bean. Coffee beans, what we drink coffee, they are like this. You see such appearance in the nucleus. Okay, so that is known as grooving of nucleus. They are also present in some cells. In papillary carcinoma, you also see local areas of calcification, calcium deposition in the form of psammoma bodies. Okay, these dark blue structures are psammoma bodies. So points to look for in papillary carcinoma: first look the papillary structure, then the nuclear features, intranuclear inclusions, nuclear grooves, psammoma bodies. Okay, that was about the endocrine. Then lungs, emphysema. Okay, this is a normal lung. There is some pigment here, normal alveoli. So this is collapse of the bronchioles. This is the alveoli where air is trapped. In this condition, there is over distension of alveoli. Also, there is rupture of the alveoli. So many alveoli, they communicate with each other. They form a big lesion inside. They communicate with each other. Here you can see lot of ruptured alveoli. They have formed a big lesion and they communicate with each other. This is what we see inside the emphysema. So in any slide, you first try to identify the organ. Okay, if you see like this spaces, it is lung. Okay, don't confuse this with thyroid. In thyroid, you will see colloid. Okay, pink secretion, and thyroid only two slides are there: Graves' disease and papillary carcinoma, where you see many papillae and cells. Lungs, all empty spaces will be there. This is another slide of emphysema where ruptured alveoli forms a big empty space. These are again alveoli. Okay, this is lung. What is lobar pneumonia? It is inflammation of the lung parenchyma. So when the infectious agent enters the lungs, there will be inflammation in the form of acute inflammation. So here all these are alveoli. Okay, but these alveoli are filled with inflammatory cells. They are filled with exudate. Okay, so these alveoli are not like this. In emphysema, there is rupture of alveoli, they are filled with airs. Okay, but here if you see, it is filled with exudate and inflammatory cells. If you see such appearance, you should write it is lobar pneumonia, affecting lobe of a lung. Bronchopneumonia affects patchy areas, wherever there are bronchi or bronchioles, the area surrounding this, including the lobes, it affects. So it is patchy, whereas here it involves a lobe or multiple lobes. So alveoli consisting of exudate and inflammatory cells. This is another picture of high power. This is one alveoli containing many neutrophils. These are neutrophils, some RBCs, edema fluid or exudate. Okay, this is what you see inside lobar pneumonia in lung. Tuberculosis of lung. It is a chronic inflammation of lung caused by Mycobacteria tuberculosis. Okay, in this condition, a specific lesion is seen, which is known as granuloma. Granuloma means a localized lesion consisting of modified macrophages called epithelioid cells surrounded by a collar of chronic inflammatory cells consisting of lymphocytes, plasma cells. Okay. Also there are some fibroblasts. Main point here is presence of caseous necrosis. In the center of the lesion, you will find presence of caseous necrosis. Okay, this is a granuloma. Many lymphocytes are there, many giant cells are there, and caseous necrosis is there. This is another granuloma. These giant cells are known as Langhans type of giant cells. Okay, Langhans, Langhans. Langhans giant cells present inside the granuloma, central area of caseous necrosis, surrounded by chronic inflammatory cells like lymphocytes, plasma cells, and a few fibroblasts. So you see many granulomas like this inside the lung in a person having tuberculosis. Okay, this is another granuloma. This is one. This is another. This is lung tissue containing alveoli. Okay. So first identify the organ. Okay, this is lung. Now this is not emphysema because we are seeing some big round structures. This is not lobar pneumonia because there is no exudate or inflammation. So this can be pulmonary tuberculosis. Okay. So like that you should write. Only 3 slides for lung. Either it will be emphysema or TB or lobar pneumonia. So first identify the organ. Here if you make confusion thinking this is thyroid, you will go wrong. Okay, from the start. So this is alveoli. All these open spaces what you see, it is alveoli. So this is tuberculosis containing Langhans giant cell, central necrosis and many inflammatory cells. This is very high power, very close view. This is one giant cell. This is another giant cell containing many nuclei in the form of horseshoe, U-shaped arrangement of the nucleus. Okay, this is another giant cell. This is another giant cell. All these are chronic inflammatory cells. Some are plasma cells, some are lymphocytes. Another granuloma, very close view, giant cell, chronic inflammatory cells. Okay, these are epithelioid cells. Same thing. This is caseous necrosis, the central area. So that is about respiratory system. Then comes to GIT. So first slide is of cancer of the colon. Okay, colon cancer histologically the most common is adenocarcinoma. Adenocarcinoma. Adeno means tumor consisting glands or arising from glandular tissue, and carcinoma because it is a epithelial tumor and it is malignant. It is not sarcoma. If it is malignant tumor coming from mesenchymal tissue like bone or cartilage, we use sarcoma like osteosarcoma, chondrosarcoma. Here it is a epithelial tumor, so it is carcinoma, adenocarcinoma. So in this you find glands which are showing hyperchromatic nucleus, pleomorphic cells, stratification inside of the cells. Okay. This is a biopsy where you see some normal glands, you see some tumor glands here. Another picture. If you take one gland, this is one gland, in this carcinoma, there will be multi-layered arrangement of cells. One cell, then two cell, then three cell, four cell, like that. Normal glands have a single layer. Okay? And usually the nucleus is uniform, the cells are homogeneous, there is no pleomorphism, no mitosis, no hyperchromatic nucleus. Hyperchromatic means dark nucleus. All these features of cancer are not present in normal glands. But here you can see stratification of the nuclei, pleomorphic nuclei, dark nucleus, mitosis. Okay, this is presence of a blood vessel here. This is necrosis. These are glands. So cancer in the colon arising, it grows deep in all the four layers. Sometimes it comes outside. It may go or spread locally to organs inside the abdomen. Okay, sometimes it may reach by metastasis to liver or lungs. So inside the colon you see all these abnormal glands with necrosis. This is the necrosis. Okay, central part. These are all tumor glands. So gross pictures. This is a picture of colon showing a growth present here. This is normal mucosa. Okay, this is the growth. If you make a slide from this area, you see all tumor glands present inside. This is another growth. This is necrosis. This is a big gland which is seen in cancer of colon. So this is another picture. Identify the specimen. You should first identify. This is not lung, this is not heart, okay. This is colon, large intestine. So this is a growth. So you have only one slide of colon. That should be adenocarcinoma colon. You have to write like that. So this is cauliflower-like growth or exophytic growth. This is the normal mucosa. Inside, if you open the colon inside, you see this normal mucosa. This is the growth. This is the cancer. Okay. So adenocarcinoma colon. On the right side, you find a napkin ring lesion. That is, the tumor is formed around the colon, encircling, complete. Okay. Suppose this is the colon, you find the tumor everywhere like this, and it will constrict the colon. So there cannot be movement inside the fecal matter. So there is obstruction. So right side tumors usually they cause obstruction, and left side tumors they cause bleeding. Okay. So patient passes stool in the blood in the stool. In both the conditions bleeding will be there, but napkin ring lesion right side more common for obstruction, causing obstruction. This is a cut specimen. Okay. So here this is the area where there is ulceration and growth. If you make a slide from this part, you may get tumor cells. Same thing, all these specimens are of adenocarcinoma colon. This is also colon, this is the growth. Now you will find glands which show stratification like this. Okay, they are not normal glands, which are growing inside the wall of the colon. Okay, so you see inside the tumor. This we have already seen. Tumor cells forming glands, glands with necrosis. This is the necrosis. Already I told you. In GIT there is one more slide, cirrhosis of liver. Okay. This is how liver looks like in cirrhosis. In cirrhosis, which is the last stage, end stage of liver. Liver cannot do function after that. It is like liver becoming useless tissue. Okay, end stage. It occurs because of many causes. In the Western countries, most common cause is alcoholism, consuming alcohol. So liver converts itself into a small mass of fibrous tissue containing lot of collagen. So it forms nodules like this. So if nodules are small, it is micronodular. If nodules are big, it is macronodular cirrhosis. So inside the liver tissue, you will find like this. This is collagen bands encircling the regenerating nodules. This contains hepatocytes. So later, these all parts is replaced by this collagen tissue. Okay. So I will show you few more slides after this. This is liver containing small nodules on the surface, micronodular. Cut section, you will find small nodules. Some nodules contain pigment, what you see, yellowish pigment is bile. This is another picture of liver. So you identify the organ first. This is not lung, not heart. Okay, this is liver. So liver, only one slide is there, which is cirrhosis of liver. So here nodules are present. This is right lobe, this is left lobe. This is another liver with big nodules, macronodular cirrhosis. If the size of nodule is more than 3 millimeter, we call macronodular. If it is smaller than 3 millimeter, it is micronodular. Okay. So you see many nodules here. This is also cirrhosis of liver. Same slides. These are all regenerating nodules surrounded by collagen or fibrous septa. In GIT, there is one more slide of the small organ appendix. So if they give this picture, it is appendix. Okay. This is not colon. So don't confuse with colon. This is appendix. So on the surface you see lot of hemorrhage, congested blood vessels. Okay. These dark colored blood vessels are congested. Congestion means presence of more blood. Hyperemia and congestion. In your third year you have studied. Okay. So congested blood vessels. This is inflamed appendix which is removed by surgery. There is edema, swelling, size of the appendix is increased, and there is rupture also. This is the site of rupture. Okay, where the appendix after inflammation it has ruptured and the contents have come outside. So they have removed this appendix. When they cut the appendix, inside it, this is the lumen. Okay, this is the layer of appendix and the fat which is attached to the appendix. This is the tip of appendix. This is another appendix with the fat, congested blood vessels here also. This is cut section of the same appendix. There was a stone present inside. Okay. What was the cause for acute appendicitis was this fecalith. Fecalith means a hard stone like particle formed from the fecal matter. So this, if it enters the appendix from small intestine and in the colon, if this enters the appendix, this causes blockage. Because of obstruction of appendix, the secretions are retained there, there will be inflammation of appendix. Okay. So one of the cause for acute appendicitis is fecalith. There can be many more causes. So this appendix was inflamed, it was removed. This is another picture, cut section. Okay, where because of fecal matter, this is also completely blocked. Microscopy, what do you see inside this slide? So in acute appendicitis, the mucosa will show ulceration. Ulcerated mucosa is one finding. You won't find these normal glands. You find lot of inflammatory cells which are filling the mucosa, submucosa, the muscle layer, or up to beyond that, serosa, all the 4 layers. Okay. So you should see presence of neutrophils inside the 3rd layer, muscle layer, to say it is acute appendicitis. Sometimes what happens, due to other causes, some inflammatory cells from the lumen may go up to mucosa, submucosa here. But it will not go to the muscularis propria, the muscle layer. So that will not be acute appendicitis. To say acute appendicitis, neutrophil should be present in the 3rd layer, or sometimes it is in the 4th layer. But if they go from here till 3rd layer, it is acute appendicitis, muscularis propria. So here you can see some area of necrosis, exudate in the lumen. This is normal mucosa. But from here to here, there is no mucosa. This is known as ulceration. And inside these layers, muscle layer, you find neutrophils. Okay, this is the fat which is normally present in appendix. So extensive neutrophilic infiltration. This is inside the lumen. This is the mucosal lining, glands. In the lumen also you see lot of neutrophils in the submucosa, mucosa and muscularis propria. All these are neutrophils. Okay, these small cells what you see, these are all neutrophils. They extend into and through the wall of appendix. So it is acute appendicitis. So in breast, this is the normal breast tissue. You see glands or acini, and this is the stroma. A tumor where, benign tumor where there is proliferation of these glands and stroma is seen in fibroadenoma. It is fibroadenoma. Very common tumor, occurs during young age. So fibroadenoma has got two patterns, a pericanalicular pattern in which the stroma surrounds rounded epithelial elements or the glands. Intracanalicular pattern in which the epithelial elements are compressed by the proliferating stroma. So I will show you the pictures. This is pericanalicular, where the stroma, this is the stroma which is growing around this epithelial or glands. This is intracanalicular, okay, where the glands are compressed by the growing stroma, slit-like spaces. Okay, the stroma is growing and it has pushed this. This is intracanalicular. So remember these two pictures, fibroadenoma, pericanalicular and intracanalicular picture. So compressed slit-like glandular spaces, and this is the fibrous stroma. This is extremely well-defined lesion, benign tumor seen in younger women, always benign, can fibrose or calcify with age. So this is a tumor, fibroadenoma. Next is in the breast, you will see another common lesion which is a tumor, malignant tumor, and histologically it is known as invasive ductal carcinoma or infiltrating ductal carcinoma. Okay, it arises from the cells of ducts. In this you find tumor cells, malignant cells in the form of cords, sheets, okay, strands, all infiltrating the breast tissue. These are malignant tumor cells, okay, lobules, cords, sheets. This is the stroma, the connective tissue part. All these tumor cells are infiltrating or growing inside the stroma. If you look at the cells closely, these malignant cells, they show atypical mitosis. They show hyperchromatic nucleus. Okay, so this is mitosis, this is mitosis, this is mitosis. Cells have got very big nucleus compared to normal cells. This is the collagen or the stroma. So another picture of tumor cells. This is fat tissue, this is stroma, which is present normally in the breast. These are again tumor glands presenting in this, spreading in the stroma. Same picture, high power, more high power, higher power. So all these are pictures of infiltrating ductal carcinoma. Okay, so if you see this dark blue type of glands infiltrating the stroma, it is a breast cancer, carcinoma of breast. Renal system. Only one slide was given, which was of Wilms tumor. Wilms tumor consists of three components: the blastema, which is the primitive tissue from which the kidney develops, epithelial components inside it, and the stromal component. So this is the blastema. This is the tumor arising in the lower pole of the kidney. This is the kidney. This tumor is seen in children. Okay, so they may give a history. A child age 5 years, 4 years with mass in the abdomen or mass in the retroperitoneum. It means there is a mass in the child. What tumors it can be? So you should think about the two common tumors that you see in the pediatric age group. And for you, in the slides, you have a tumor on kidney, Wilms tumor. So in that way, you should think. This is the blastema. The epithelial component means the cells, they form epithelial structures like tubules. Normal kidney has tubules. Okay. So this tumor also shows tubule-like structures or glomerulus like structures like this. This is the epithelial component. This is the stromal component. Stroma means the interstitial tissue, mesenchymal tissue. It can be formed by muscle. It can consist of muscle. So these three components are present in Wilms tumor. It is known as triphasic Wilms. If you see two types of cells, it is biphasic. If you see only one type of cells, it is monophasic. So triphasic, biphasic and monophasic. This is a slide of triphasic Wilms tumor. The other name for Wilms tumor is nephroblastoma. Okay, nephroblastoma. These are glomerulus-like structures, which tubules. These tubules are the epithelial component. This is the stroma. Okay. Then we have central nervous system. Central nervous system, actually they have not given any this thing. Any presentation. I have showed you glass slides on microscopes, if you remember, before your vacation. Okay, I have shown you about astrocytoma. In astrocytoma, diffuse astrocytoma, pilocytic astrocytoma. Then the grade 4 astrocytoma known as glioblastoma multiforme, GBM. Okay. Then I also showed you meningioma and ependymoma. So the presentation is not given by them. I have selected a few pictures. I will show you. This is from the internet. Okay. So just to make you more familiar with pictures, what is this organ? Don't hurry. In exam also you do like this. Try to look what is this? What are the systems that we studied today? What were the systems? Renal, okay. Then cardiovascular, then GIT, thyroid. What do you see in thyroid? Follicles and colloid. This is colloid. These are follicles, okay, and you can see papillary structures like this. This is normal follicle. This is colloid scalloping, clearing. Hyperplastic glands. This is Graves' disease. Okay. Another picture of Graves' disease. Colloid, follicles. This is clearing, scalloping of colloid. Okay, colloid scalloping. What is this? In thyroid, next slide is. What is another next slide for thyroid? How do you say it? Yes, this is orphan annii nucleus, papillary structure. All clearing of nucleus can be seen. The moment you see the slide, it is all clear nucleus. Okay? So this is papillary structure with fibrovascular core, orphan annii nuclei. It's papillary carcinoma, thyroid. Now in CNS, there is a slide called secretory meningioma. So tumors arising from the meningothelial cells, they show secretions like this, pink secretions. They are known as pseudo-samoma bodies. We saw samoma bodies in which tumor? Papillary carcinoma, thyroid. Okay, we saw samoma bodies. They are concentric laminated calcified structures. So here also round pink secretions, they are seen in secretory meningioma. Okay. Pseudosamoma body, meningothelial structures, the cells giving rise to tumor, benign tumor called meningioma. Astrocytoma, arising from astrocytes, consisting of astrocytes in diffuse sheets. This is brain. Okay, this tissue is brain tissue. Diffusely you can see very small cells and lot of This is brain parenchymal tissue. This is diffuse astrocytoma. Diffuse astrocytoma. So if you look like this, look at this, it is diffuse astrocytoma. Now another tumor arising from astrocytes where you see these fiber-like structures, pilocytic, okay, fibrillar, fibril-like structures, pili. So it is known as pilocytic. So these thick fibers are known as Rosenthal fibers. Rosenthal fibers, all these, and these are piloid fibers, piloid structures. So these are all astrocytes from which you can see these fibers coming out. So this is another tumor of brain, astrocytoma, but it is pilocytic astrocytoma. Okay. So WHO has given grading for astrocytomas, grade 1, grade 2, grade 3, grade 4. So usually these pilocytic astrocytomas are considered as grade 1 or grade 2 tumors. Okay. Whereas diffuse astrocytoma are grade 2 tumors. And anaplastic astrocytoma is grade 3, and GBM, next slide I will show you, glioblastoma multiforme, it is grade 4 tumor. So GBM is very common compared to other tumors, and it is the most dangerous because it is high grade tumor, grade 4 tumor. This is pilocytic astrocytoma. This is GBM, glioblastoma multiforme. In this tumor you find necrosis, cells which are large, okay, atypical, lot of mitosis, necrosis, hemorrhage, everything can be seen. See, many giant cells are seen. To see such big cells in the brain, always think about glioblastoma multiforme. Ependymoma. This tumor arises from ependymal lining. Ependymal lining is present in the ventricles, okay, where the CSF is formed. So a tumor arises in that canal, it can cause obstruction of this. So in ependymoma you find such rosettes. These round structures, they are not glands, okay. You will find a central blood vessel. They are pseudo-rosettes. Pseudo-rosettes means cells, they are circled around a blood vessel. That's why pseudo-rosette. If the cells are present with a space in between, it is known as true rosette. So in ependymoma you will find these pseudo-rosettes, flower-like structure. Rosette means flower-like arrangement of cells. So if you see such round structures, and if the history is that the person has headache, some tumor in brain or something like that, think about ependymoma. This is also ependymoma. This is another rosette-like structure. Okay, ependymoma. This is the blood vessel around which the cells are forming arrangement. Yesterday Abdullah has sent me the list of slides. In that, renal cell carcinoma is also there. But from the female side, they have not given me this slide. I don't know whether they will keep for exam or not. So I will show you the picture. Tumor of kidney, a malignant tumor arising from the epithelial cells. The cells are clear, or sometimes they contain pink granular material. So based on the cells, they are either clear cell carcinoma or chromophobe RCC. Chromophobe means they contain some granular pink material. So this is renal cell carcinoma. Okay, clear cells with nucleus which are present in the cells are arranged in lobules. This is renal cell carcinoma. Wilms tumor, already I showed you. 3 components are there: blastema, epithelial components, and the stromal components. This is the blastema. Here you can see. This is the epithelial component, the glands. Okay, and this is the stroma. Already I showed you about this adenocarcinoma. This is another picture from internet. Adenocarcinoma of colon. So here you can see the normal glands which contain single layer of epithelium, the tumor glands which are dark in color. Okay, so there is a difference between normal glands and the tumor glands. So these glands from the tumor are growing inside. This is normal gland, this is the tumor. Okay, this part is the tumor, the cancer part in the colon. Cirrhosis of liver, this is normal liver, this is how nodules look like, micronodular or macronodular. This is another specimen of cirrhosis of liver. Inside the liver you will find this collagen fibrous bands surrounding these regenerative hepatocytes forming nodules. Okay, this picture already we have seen, cirrhosis of liver. Appendix, red color, because of acute inflammation, hyperemic blood, congested blood vessels. This is appendix, acute appendicitis. Inside you see normal mucosa, ulcerated mucosa here, full of inflammation. All these dark blue cells are neutrophils. So acute inflammatory cells in the muscle wall of appendix. Emphysema, already I showed you. This is the lung tissue, large alveoli, it is emphysema. Same picture. Lobar pneumonia, alveoli filled with exudate consisting of neutrophils, RBC and edema fluid. And this is lobar pneumonia. Tuberculosis of lung, this is lung tissue. Okay, here you find granuloma, here is another granuloma. So in each granuloma you see color of lymphocytes, collection of epithelial cells, a Langerhans giant cell, central caseous necrosis. Another granuloma, fibroadenoma of breast. What is this pattern? There are two patterns. Just now I told you two patterns. One is intracanalicular, one is pericanalicular. So this is intracanalicular pattern where the stroma pushes the glands. Okay. Pericanalicular is like this, where the stroma grows around the glands. Carcinoma of breast, also known as infiltrating ductal carcinoma. So all the tumor glands infiltrating the stroma. This is also carcinoma of breast. Carcinoma of breast. This is a thrombus, blood vessel with thrombus inside. This is another thrombus which is forming inside. Okay. These are lines of Zan, alternate pink and pale lines. Lines of Zan because of RBCs and platelets. What is this? No, sorry. This I have not shown you till now. Till now I have not shown you. Can you identify what organ it can be? Yes, very good. This is kidney. So this is cysts, multiple cysts. So this disease is polycystic kidney disease. Okay? Polycystic kidney disease. Because Abdullah has messaged me, there is a jar for kidney, but females, they have not given me this jar or photo anything. Just I am showing you. If they keep in exam, you can write this. This is kidney with many cysts, polycystic kidney disease. Okay? So it is a genetic disease, autosomal dominant or autosomal recessive disorder. The patient will have kidneys which are like cysts. They have multiple cysts inside the kidney, like this. Polycystic kidney. So that's all about the revision thing. I hope you have understood, you remembered. You people can go through this. If before exam, if you want once again, I will try to take. Okay? Is it okay?